conference voted by 48% to 47% to ask GPC to try and establish whether we can change the rules about charging NHS patients for private services. It's a very, very complex issue. At the moment, I can't charge NHS patients for a service that the NHS does not provide, but that I could provide privately. And in Wales, that's just a straightforward anomaly. It looks peculiar. Yet, curiously, in England, this is about to change because GPs will be part of the decision-making process through CCGs as to whether something is provided on the NHS or not. So curiously, although this anomaly seems very unfair to many parts of the UK, in England it could be construed that GPs were saying, well, we won't provide this on the NHS anymore because our patients can have it privately from us. Now, to add to the complexity, what could happen, even so, is that I could refer my patients to Dr Bloggs down the road and he could do whatever it was privately and he could do the same for me. Now, that's not very good practice, it's not an ideal arrangement, although it's quite common. But what we need to do is get rid of this set of anomalies. In the 3 Celtic nations, it's just straightforward unfair and doesn't make sense to patients and offers patients better choice. But in England, we are going to have to deal with the taint of conflict of interest. That's why conference voted such a close vote. It's difficult for GPC to interpret this as a strong mandate because clearly it's a very confused vote. It's much easier when it's 99% versus 1%, then it's easy to decide what to do, but this is going to be much more difficult. Clearly we'll have to approach the government because it is confusing. It doesn't make sense to patients or GPs that a patient has to be seen. Instead of seeing the NHS GP by a private GP who might well be another NHS GP, just not theirs. That doesn't seem right. So we will now have to find out whether we can make more sense of this, dealing with conflicts of interest in England and dealing with anomalies in the 3 Celtic nations.